To the Arc Woman podcast. This is an exploration of womankind. Here we discuss random to create a bounty of health for the body, mind, and spirit. Hello, Kelly. Thank you so much for joining us on the podcast today. I really appreciate your time. Do you mind introducing yourself and talking to us about who you are and what led you to become a doctor of naturopathic medicine?
Sure. So initially, what led me to pursue naturopathic medicine was my interest in nutrition. And I knew that in the conventional medical setting, there isn't a lot of nutritional discussion that goes on. And so my interest in nutrition led me to seek other methods of treatment and how to tie nutrition to foundational health and chronic disease. So when I discovered naturopathic medicine was kind of the best of both worlds between conventional diagnostics and learning about the body the same way that conventional colleagues do, but a whole different set of tools in the toolbox, including herbal medicines, supplements, and dietary factors. So I like to think about naturopathic medicine is a root cause approach and a holistic approach to health, which really intrigued me. And I've loved practicing in Chicago for the past 15 years.
Wow, that's amazing. And you were just telling me previously that you started in bioengineering and then you moved over to naturopathy, and you don't know of anyone who's made that. And I guess when you're doing bioengineering and when you're training to make these tiny little machines that can work in hearts and valves and all of these other things, it doesn't seem in that community that the natural progression is naturopathy. But I guess for you, doing lots of math and biochemistry, it is a duh moment, of course, because naturopathy is almost the modern iteration of holistic medicine and understanding all of these really complex mechanisms in the body, how they're all interconnected, which is in of itself kind of biochemistry and is bioengineering as well. You're just bioengineering with herbs and supplements and doing really personalized lab testing and figuring out what the health looks like for this individual person, which is wonderful. And I think just seems like a natural progression. We're talking about the gut today and talking about systems in the body. I think it was in 2012, everyone became really obsessed with the gut. And so you probably saw that. You've been practicing for 15 years. So you were probably like, yep, everyone came into my office in 2012, 2013, wanting to do gut microbiome testing. Do you mind introducing in a nutshell what the gut microbiome is, which is a huge ask of you because you're probably like, where do I start? But do you mind giving us just the nutshell of what it is before we get into the nitty gritty of the gut microbiome in relation to women's hormones and hormonal health over the lifespan?
Yeah, absolutely. So it's fascinating that our gut is home to trillions of microbes. And collectively, we call that whole community the microbiome. So that's the good, the bad, the gray area, and how your liver processes things, how your body absorbs nutrients from food, and how your gut actually makes bacteria on its own. So one of the things patients sometimes ask me is, do I have to take a probiotic? Well, no, we actually have a mechanism for making our own good bacteria. So essentially, it's the community that lives inside of you that actually outnumbers our human cells. It's really fascinating.
Yeah. And there's more DNA as well because we have a diversity of gut microbes there as well. And we want as many different types as we possibly can. And I think just gut mapping through ancestry and looking at how gut microbes have changed throughout history and for even different races of people is also really fascinating. I feel like I could just go down a huge rabbit hole with that. And I think what you just explained is really important. Of, do I just take a probiotic? That's under the assumption that everyone's gut microbes are the same and everyone will benefit from the same microbes, but your body knows exactly what it needs. And if we give it the right tools and the right environment, it'll be able to maneuver its gut microbiome for our own personalized health. So let's get into the gut hormone axis and female health. So could you illuminate some key ways in which estrogen, progesterone, and testosterone shape the landscape of our microbiota? And in turn, how does this microbial community orchestrate the metabolism and availability of these hormones? Huge question, but I'm sure you'll nail it.
Yeah. Interestingly, well, I guess I'll start with some basics. And I always go through this discussion with patients when they're in the office or being seen remotely, is just thinking about the cycle in these two halves. So of course, the first is the follicular phase before ovulation. Estrogen's the main driver, helping that follicle mature in the ovary. And then after ovulation, that's where progesterone steps up to prepare the uterine lining. So both of these hormones just made bispecific cells in the ovaries with signals from the brain. So testosterone's a little bit different. It's not made just in the ovaries, also made in the adrenal glands, and doesn't have any cyclic fluctuation. So there isn't such a linear relationship between each of those hormones and specific bacteria. The one, I guess, that has the most specific relationship is estrogen. Estrogen gets recycled in the body and broken down into various metabolites known as the oestrobolome. But aside from that, basically, we're just thinking about this community and how the hormones are talking to the bacteria and vice versa, the bacteria talking to the hormones.
Yeah. And I guess, could you also say that there are some things happening in the gut that predispose to different hormones being made, like cholesterol, for example? And would you also say that maybe the gut hormone axis might impact our reproductive hormones via insulin signaling and insulin sensitivity, which we know has a huge connection to the gut as well, especially for testosterone with PMOS individuals? Would you say that there's a little bit of a connection there?
Exactly. And that makes me think of the two big families that are studied pretty regular. Firmicutes and Bacteroides. Those are big families of bacteria. Firmicutes, when that's high relative to Bacteroides, that's more associated with insulin resistance and diabetes and PMOS. So that's where we get into the relationship of insulin and metabolic factors related to the gut.
Yeah, perfect. You did mention before the oestrobolome, which I think is one of the most fun words to say. Do you mind explaining what the oestrobolome is and why this concept is so central to understanding women's hormonal health? Does the current evidence actually tell us anything about dysbiosis-linked disruptions in the oestrobolome and how it relates to women's hormonal health?
Yeah. So think of when your body handles estrogen, it has to be detoxified. And so that starts with your liver. Think of your liver as like the bouncer at the door. It's going to see everything. It's going to see your caffeine, your alcohol, your medicines, your supplements, and even your own hormones. So then as things move through the liver, pathways like methylation and conjugation happen to those various substances, including estrogen. And estrogen gets metabolized into many different byproducts. So there's not just one estrogen, there's many. And so then these metabolites travel through the gut, and that's where the microbiome steps in. And so depending which bacteria depending on which bacteria are there and how they behave, the estrogen can get recycled back into your bloodstream, and some of it gets cleared out through regular bowel movements. So there's a lot of bacteria involved in that process. Some are famously known for producing an enzyme called beta-glucuronidase, which essentially flips estrogen back into an active form, and it gets reabsorbed. When estrogen gets reabsorbed, it can bind to those same receptors that estrogen that would normally be made also binds to. So this can lead to things like estrogen-linked conditions, whether that's fibroids or cancers, other types of growths. So we want to keep our estrogen flowing through our liver and being detoxified through our gut.
Yeah. Beta-glucuronidase is turned off by calcium D-glutarate, is that correct?
Yeah.
And that type of estradiol, it's that 16 estradiol, it's highly associated with the development of breast cancer, fibroids, endometriosis. So we do really want to get rid of this. So the relationship between the gut and mood is increasingly well documented. In the context of women's hormonal cycles, what's the specific link that you know of between dysbiosis and mood dysregulation? And just anecdotally, I remember I had a client a while ago, and she had quite severe PMDD. She had very severe suicidal ideation. She would want to break up with her boyfriend. She would want to quit her job as soon as she had ovulated, like very, very intense PMDD. And she told me a month after I'd seen her and she'd applied all these changes, I took an antibiotic and my PMDD symptoms have gone away. And I'm not saying to anyone listening to this, go and take an antibiotic, your PMDD will go away. But I said, that's really fascinating. And to me, really spoke to the gut axis with our hormones. Could you speak to how PMDD connected to our gut and what that connection looks like and why that client might have seen that change just by simply changing her gut microbiome?
Right. Well, let's start with some of the famous players, neurotransmitter wise, that are made in the gut. Of course, we know about serotonin, and serotonin is just one of a few. We have dopamine, norepinephrine, epinephrine, GABA, and they all have various effects on the brain. And so when the microbiome gets disrupted, the signaling of those mood chemicals can also be disrupted as well. So the gut imbalance isn't necessarily the problem, but sometimes it's also individuals are primed to anxiety or depression, and then the hormones kind of amplify the imbalance, going back to the normal fluctuations of the cycle. Progesterone climbs and then drops sharply right before the period. And the brain's so sensitive to those hormonal ups and downs. And then the gut is constantly talking to both your hormones and your brains. So we think about the chemical messengers like the serotonin and the GABA, the calm and steady state. And when those get out of balance, the hormonal shift is actually a heavier hitter. And next is inflammation. So when we have the gut lining bacteria that might be abnormal, things like leaky gut or foods that don't agree with your system, that creates inflammation. So then we know that sometimes in PMDD, inflammation is a big driver. And the next is stress. So hormones like cortisol can also leave your neurotransmitters out of balance. So that can be like the perfect storm between the chemical messengers, the inflammation, the stress signals, and the PMDD is never just in your head. The brain is generally sensitive to those types of hormonal changes and the inflammation that could be happening in your gut.
Yeah, so a dysbiosis in the gut means that you're not making serotonin in the day, which means you're not making melatonin at night, which can really mess up your circadian rhythm. You're not making dopamine, you're not making serotonin, therefore you don't have your happy drive hormones. So you can feel really, really anxious and then you can feel really, really depressed. It's just this roller coaster that I think women experience. And I don't think a lot of women really know. And even I remember speaking to a doctor, I think it was last year, saying, hey, did you know that serotonin and melatonin are precursors in the gut and your gut has an axis with your brain? And she was like, no, it's not. Serotonin's not made in your gut. And I just thought, wow, okay. Someone hasn't read the literature in about 13 years. Cool. But I thought that was really interesting that there is this huge connection with your gut. And that kind of goes back to what Hippocrates says, that health really is defined and starts in the gut. And that couldn't be more true for PMDD. Could you please help us differentiate between primary dysbiosis, where the microbial structure is out of balance, and secondary dysbiosis marked by dwindling metabolic activity and diversity? And why is this distinction really important? Because I think a lot of people understand dysbiosis in the gut is not good, but no one really understands that there's different types of dysbiosis, and figuring out which type of dysbiosis you have is really critical to how someone treats you.
Yeah, that is a really important and clinically useful distinction. And so I'll use an analogy that I think helps us understand that distinction, is that think of your gut as like guests at a party. And so primary dysbiosis is like a guest list problem. It's like who shows up. It's the wrong crowd. They're not the people you want to be at the party. And so the party, doesn't go according to plan. Secondary dysbiosis is something else going on. It's like the right people are there. They're not behaving how they should. So there's something upstream that's driving it. Maybe there was a fight earlier. Maybe there was, something in the news that caused people's moods to be off. So it's about the community structure in primary dysbiosis. And then secondary dysbiosis is about function in response to something else. So primary dysbiosis, a great example of something that would drive that would be taking antibiotics, like you just spoke to, a bad infection, sudden extreme diet changes, prolonged fasting, things like that. And then secondary really shows up in the context of something that's pre-existing, like diabetes. We talked about those different families of bacteria that can be influenced by insulin resistance or long-term medication use. There's more upstream drivers. And so it's important for treatment then, because if someone tells me, they haven't been well since they had C. diff, well, we think, all right, it's the people at the party. Whereas if someone comes in and they have diabetes, we think, okay, well, it's the metabolic issue that's systemic we really need to work on that will help regulate the gut.
That was so beautifully explained. I love the bouncer in the liver, the people at the party. I think that's really wonderful. And it's really great to just visualize that if you
Yeah.
have people in the party who are
Mhm.
not making short chain fatty acids and they're drinking all the booze and
Yes.
they're bringing the vibe down, that's a people problem. You need to clear them out with an antibiotic and get the bouncers in there and get them out. That might have been that person with PMDD, right? But
Mhm.
if you're having a situation where the right people are there and you do a stool test, adding more people into the party, so going, okay, there's heaps of lactobacillus here, let's just add more with a probiotic. That's not going to fix the problem because it's
Yeah.
how that maybe these people aren't drinking the
Mhm.
glucose and they're not
Mhm.
producing short chain fatty acids. I think that's a really great way to think about it. And it really goes back to that original point that I made before, that just taking a probiotic or just eating more fermented foods might not be the answer for you. And you really need to find out if it's a people problem and
Yes.
maybe you need to clear out the people or add in the right people, or if it's
Mhm.
we can maybe do some nonviolent communication training with the people at the party, get them to do their job, right?
Yeah.
Next, let's go into the reproductive years. So cycling years. So when you're having your period, so
Mhm.
before you, so as you're having your first menses, so your first
Mhm.
menarche up to perimenopause. So estrogen and progesterone rise and fall throughout the menstrual cycle. You've spoken about this before, but is there any inclination that the microbiota responds? Do we see any consistent patterns in microbiome shifts throughout the cycle for women who are cycling? Or is it kind of just a steady state that we're seeing? We know we see a pretty distinct change in the vaginal microbiome, but do we see it in the gut microbiome?
Yeah, that's an interesting question. And what I've found is that there aren't big shifts throughout the menstrual cycle. In studies that track stool samples across the cycle, they didn't see any big swings across diversity in overall composition that would like line up neatly with each phase of the cycle. And so it is present. Certainly, those sorts of shifts are present in the vaginal microbiome, absolutely, but not so much in the gut microbiome.
Okay, wonderful. So many women, they report distinct GI symptoms across their cycle, like bloating, constipation, and diarrhea. I think the very common story for women is in their luteal phase, it's a
Mhm.
little bit of constipation.
Yep.
And on day one of their period, they have period poo. So all the poos
Right.
that they could have had during their luteal phase, they're having
Right.
on their period, and it's a little
Right.
bit overwhelming. We could
Yeah.
put that down to prostaglandins, we could put
Right.
that down to progesterone. But
Mhm.
the hormonal shifts, do you mind explaining what that is? And so if it's not microbiome shifts,
Mhm.
what is creating this change in GI symptoms that I think a lot of women might connect to the microbiome, which we know isn't really the cause in this case?
Mhm. Yeah, it's one of those upstream drivers, right? So you mentioned prostaglandins that ramp up and suddenly, you swing the other way into diarrhea if, towards the beginning of the cycle, those prostaglandins spill into general circulation and up contraction. So that doesn't neatly stay in your uterus when you shed your lining, but it also goes systemic, which is low grade inflammation and altered immune signaling. So if your gut is already primed to those sorts of irritations, then you layer on the hormone withdrawals and the prostaglandin bursts. It's like throwing fuel onto the fire. So day-to-day symptoms might get magnified there.
Mm. What would you recommend for these women? So prostaglandins could be
Mhm.
things like omega-3s
Right.
and maybe more fiber. Like, what
Right.
would you recommend to a woman presenting in your clinic who says,
Mhm.
I have constipation for 5 days and then I have period poos, I have all this bloating and GI distress? Like, what would you recommend? Like, what are the 3 things that you think are most important in that case?
I think fish oil and omega-3s are so important. EPA and DHA are my favorite anti-inflammatory tools. Additionally, I think magnesium, and there's different types of magnesium, so you have to choose the right one that kind of works with the body with muscle contraction, like calming magnesium. Magnesium glycinate can be really helpful. And then I always also think about maybe shifting nutrition a little bit towards the end of the cycle, maybe ramping up soluble fibers, so fibers that help absorb water. Things like psyllium or ground flax seeds are good examples of that. And that can help make up for the increase in the motility and absorb water so stools can become a little bit more formed.
Mhm. Beautiful. And would you also recommend perhaps blood sugar balancing as well. So making sure you're eating fats, carbohydrates, and proteins in equal variations, and making sure you're eating a lot of fiber with carbohydrate sources to make sure that your blood sugar balance is happening as well, because we know that blood sugar regulation problems can have an impact on the GI system as well. Could you speak to that?
Absolutely. And I like to share with my patients a visual and think of this divided plate. So there's the 50% portion of the plate, and then there's the two quarter sections of the plate. The 50% portion should be vegetable fiber. One of the quarter sections of the plate should be protein. And then the last quarter section would be a carbohydrate. So like a potato or rice. So that type of plate should keep your blood sugar really balanced. Some individuals are more susceptible to grain sensitivity, where they might have a higher spike and therefore require less servings per day, perhaps, or serving quantity of grains. But the basic plate portions to focus on would be the vegetable fiber, protein. I didn't mention healthy fats, but those are important too to have on each plate.
Yeah, absolutely. Let's go back to PMDD. And when it comes to PMDD, could dysbiosis act as both the trigger and the result of underlying inflammation and metabolic chaos? What does the latest evidence reveal about restoring the microbiota as a potential therapy for PMDD? So we touched on this lightly before. Maybe we could go a little bit deeper into PMDD and its connection to the gut here.
Sure. Well, this is really fascinating because I think that's one of the most exciting research frontiers in gut health, is linking specific conditions to maybe specific bacteria. So there are some nicely designed studies that are looking at specific bacteria. Some of the names are tricky to say, but one strain in particular called Lactobacillus paragaceri that can actually help improve PMDD symptoms. So I think what's interesting is that hopefully we continue to learn how specific bacteria behave and then how they affect neurotransmitters being made in our gut. So it's promising to see some research about specific strains that can be used.
Okay, amazing. And so what would that look like for a woman with PMDD, for example? Would she come in, have a stool test? We can look at what her microbiome looks like and then go, oh, there's actually gaps here that we see when we have low amounts of this or high amounts of this that's associated with this symptom. And you can supplement in specific microbiome players like lactobacillus, for example, like what you just said, and see an improvement in her symptoms. Has that been used, or are they just going, okay, this is a pilot study, we've seen there's a connection, and then maybe the backup study after that would be applying that knowledge and seeing if that can be used clinically? Like, do you think there's a possibility for that to be used for women with PMDD?
Yeah, it's rarely a one size fits all is the first thing. And in research, they like cause and effect and more linear relationships. But I think it might be more multifactorial than just a single probiotic, because we have to think about the whole microbiome. And if we're not eating enough fiber-rich foods to make short-chain fatty acids, well, then maybe those probiotics won't work so well. So I think it has to be a multifactorial approach where we're taking into dietary strategies, fiber, and supporting the gut as a whole, and then adding in some specific strains. The limitation to gut microbiome testing is it's not testing everything it possibly can, nor are some of these strains commercially available. So microbiome testing gives us a nice overview, but it can't always point to the specifics.
Wonderful. Thank you. PCOS, now known as PMOS, is closely tied to insulin resistance and chronic inflammation. How does dysbiosis both fuel and stem the metabolic turmoil in PMOS? And when I say metabolic turmoil, I say really ingrained insulin resistance that we see in about 95% of patients with PMOS, regardless of whether they are overweight or obese or not. And what does the gut microbiome play in managing these androgen levels as well? So there are a few pieces to this puzzle. We have a woman with PMOS. How do androgens and insulin play into the gut? And how does the gut play into these hormones that can cause all of these different hormonal cascades and symptoms that women with PMOS experience?
Yeah, well, the name PMOS is a much better name for the condition because it reflects that the ovaries aren't really the central problem. They're a result of that metabolic issue that you just described. And how I'll explain it to patients sometimes is thinking about, you have diabetes in your ovary. It's not always systemic insulin resistance or diabetes or obesity. I see a lot of women that are lean and don't have any metabolic markers that are abnormal. but we're still going to work on blood sugar regulation and insulin resistance as a part of any PMOS case. So when we look at women with PMOS, the main thing is that there's been shifts in microbial diversity, which bacteria are present. So this might be a good example of the secondary dysbiosis. There's an upstream driver in those metabolic changes. So lower diversity in the gut can track with higher total testosterone and the classic signs of androgen dominance that we see in PMOS. Also, when there's less diversity in the gut, the intestinal barrier can become weak, get more permeable, and inflammation can become systemic. So this low-grade inflammation can also interfere with how hormones are being signaled to be produced. And then that feedback on the brain can further drive the dysfunction between what hormones are being made in the ovary.
And that's the thing that I think was really popular a few years ago with the rise of the obsession with the gut was leaky gut. Do you mind explaining to us really quickly what this is? I guess the official name for it is intestinal hyperpermeability and what that might mean, because I think a lot of people go, okay, leaky gut inflammation, but how? For everyone listening, inflammation is a tool used by our white blood cells. It might be from things like histamines and cytokines, and they create these big storm to create space and do their job basically. But what does that mean when we connect the gut with it being hyperpermeable and also our white blood cells? And what does that mean for women with PMOS?
Right. So with leaky gut, basically what's happened is the gut barrier should be selectively permeable. So that just means, our nutrients, our vitamins, our minerals, amino acids should get through into our bloodstream. Of course, that's how we get nourished. But when it becomes inflamed, the gut lining becomes more permeable to toxins, to abnormal bacteria, medicines, foods that might be more pro-inflammatory. And then systemically, that can give rise to inflammation. And when inflammation is present, that can affect the way that our body processes our food. It might have a harder time responding to the insulin signal and using insulin to adequately metabolize glucose into the cell. And so when that happens, when glucose is stuck in a sense, that can increase androgen levels in women with PMOS, causing that irregular follicular development and irregular ovulation patterns.
Wonderful. You explained that so beautifully. Thank you. Let's move on to pregnancy. I think this is where a lot of women start to see changes in their vaginal microbiome, but also in their gut microbiome, which I think is a little bit hard for women to figure out because they are growing a big fetus and everything is changing. Pregnancy brings these huge hormonal changes, and research is revealing striking shifts in maternal microbiomes. What drives these changes, and how do they impact the health of both mother and baby?
Yeah. Well, let's put these hormonal shifts into perspective. So by the third trimester, estrogen can be roughly 20 to 50 times higher than the peak in any regular menstrual cycle. So across a single pregnancy, your body produces more estrogen during like all of your non-pregnant years combined. So think then about how your liver is going to handle all of this. It has a lot of work to do. We talked about the estrobolome, and we talked about, this ratio of 2 families, Firmicutes, Bacteroides. So what happens is that in pregnancy, to some extent, all women become insulin resistant, and that's by design. We want fuel for the baby, no matter what, feast or famine. And so it is important to some extent that your microbiome actually shifts to accommodate that increased energy need that during fetal development. However, if it tips too far, there's problems that can show up like gestational diabetes or preeclampsia or weight gain. So in summary, it's somewhat unavoidable, but also there's a tipping point to where it might lead to more problems with the microbial shifts.
The more I learn about pregnancy, the more I am just surprised and in awe of the power and the intelligence of the female body. It's just absolutely incredible. Could dysbiosis during pregnancy raise the risk of gestational diabetes, preeclampsia, or poor health outcomes? And what does the latest research indicate? And are there any particular microbes or metabolic markers linked to these risks? You just talked about gestational diabetes and preeclampsia. What about other poor outcomes? And do these possibly pass on to the fetus as well?
Yeah. So on gestational diabetes, I think it's the insulin resistance is the driver, the reduced diversity, altered bacterial ratios, and those bugs that really want to harvest energy. And so with preeclampsia, the lower diversity can be associated with inflammation. And so then with inflammation, can come the leaky gut that we talked about, more pro-inflammatory and more toxic to the blood vessels, making them less responsive to normal signaling mechanisms. And poor birth outcomes, oral and vaginal and even gut microbiomes have been linked to preterm birth, growth restriction, miscarriage, and particularly in women with PCOS, some of the metabolic markers can be associated with premature aging of the uterine lining in pregnancy. So it's really important to address the gut microbiome for all of those reasons, and to think of the gut as treating the gut as being prevention.
And treating the gut as a part of our metabolism. I think a lot of people think of the mitochondria. Everyone's obsessed with the mitochondria at the moment, thinking about the liver, thinking about the pancreas, but no one really takes into account the gut and how important it is as an insulin resistance prevention tool.
Yes.
And if we look at the gut in pregnancy, it can also help to prevent gestational diabetes and preeclampsia, which are quite serious. I think they're becoming more and more common, which means that more and more people are used to it, but I don't think we should normalize dysfunction in any sense of the word, especially during pregnancy.
Right.
Speaking about mood changes, these are common during pregnancy and after birth. To what extent do these shifts in the microbiota and inflammation from dysbiosis be responsible for these emotional ups and downs? Or would you say it's mostly that huge hormonal shift going from that huge amount of progesterone and estrogen, and then after the birth of placenta, we're seeing a big plummet? Do we see any interaction with the microbiome here and in the gut?
Yeah, I think you're right. I think that is probably the main driver, these huge shifts in hormones from pregnancy to postpartum, coupled with, sleep is changing, your diet changes, antibiotics that may or may not have been present during delivery. So it can be a perfect storm of change for the microbiome. So I think that the important thing to do is think about how we can correct for those big swings through nutrition. Thinking about gut health in the simplest terms is going back to healthy nutrition, regular movement, protecting your sleep as much as your new baby allows, and avoiding antibiotics if you can. That's part of protecting the resilience factor after birth.
Do we see any huge shift with pregnancy and then after birth? And is the microbiome of, say, hey, if I fell pregnant right now, would my microbiome before being pregnant and then after being pregnant and giving birth be different? Do we see any changes with microbiome shifts with women after their pregnancies and after they've given birth that might relate to fetal health?
I think that is fascinating, and I think it has to. And I think that it goes back to that multifactorial cause that could be related to not only the hormonal shifts, but also everything else that goes along in the postpartum state. So yeah, the differences might be very significant. But I think women, when they go back to their baseline, as far as post breastfeeding, cycling normally again, that the microbiomes would probably be similar.
And then for women who are planning a pregnancy or already expecting, which proven dietary supplement or lifestyle strategies best nurture the microbiota and promote healthy outcomes? What are you repeating? Are you saying sauerkraut a lot? Are you saying soluble fiber? What are the things that you're recommending to these women?
Right. So preconception planning is so important. So I think that's an under-recognized tool of how to prepare women, not only for conception, but also this translate to health throughout the lifespan of the child. So it's not something to just gloss over and say, here, take a prenatal vitamin and call it a day. So the things that I say over and over again are to eat a diverse and fiber-rich, minimally processed diet. So diverse just means don't eat the same things over and over again. Try and buy new foods each week, eat seasonally. And because a diet should be mostly plant-based, to me that means that 50% portion of the plate filled with vegetables at every meal. We still want to include proteins and carbs. And then minimally processed. Think of foods like foods with added sugar, alcohol, caffeine as treat foods. As far as fermented foods, those can also be really helpful. Things like yogurts, miso, kefir, sauerkraut, kimchi. I think there's kind of a tipping point there. I've seen in practice that sometimes people overconsume those food groups thinking they're so good for you, and then might end up with some digestive troubles as a result. So it's good to have some exposure to those foods, but not overexposure. And maybe your gut will tell you if there's a issue with how much you're consuming.
Awesome. All right. I'm really surprised that pregnant women can overdo it. I think that's the first thing, at least for my friends that have experienced pregnancy, is that the last thing they want to eat is sauerkraut.
Yeah.
They're like, I don't want it.
Right.
They will force themselves. I've seen my friends block their nose and force themselves to have their spoon of sauerkraut daily. So I'm surprised that women have been overdoing it. Let's go into menopause. So do you mind quickly just explaining what menopause is for our listeners? Because I still think in the zeitgeist of women's health, we don't actually understand what menopause is. And then we can start talking about what menopause is in relation to the gut microbiome.
Yeah, I think that's really important because the terminology is confusing and it gets mixed up. So starting with perimenopause, that's the time period leading up to the pause. So maybe it's 5 to 10 years before you have your last period. So then comes the menopause. It's technically that 1 year period after your final period. It's the waiting. Are you going to get another period? Am I done? And then the postmenopause are all the years that follow.
Okay, wonderful. And they say that menopause is one day. It's the day that after a year of you not having a period, you have entered menopause. So we're talking to you women listening who are in menopause and you've passed that year where you haven't had a menses. So when this arrives, this one singular day and beyond, and estrogen levels plummet, how does the microbiota react? Does dysbiosis become more common or severe during this transition of perimenopause to menopause?
Yeah, absolutely. It's interesting because the microbiome becomes less diverse in response to the absence of estrogen. And it actually starts to look more like a male microbiome, which can be associated with central obesity, hypertension, more inflammatory or metabolic markers. And of course, there's the vaginal microbiome too. We know that that's influenced by estrogen. And so after menopause, the lower estrogen doesn't just affect, hot flashes and mood. It really does reshape your gut. Less diverse, fewer species that are more protective, and more that promote inflammation, insulin resistance, and therefore weight gain. Sometimes women will tell me that, they've been the same weight their whole lives, and now they're on a new diet, a new exercise plan, and they just can't quite crack the code on what to do. And so I think that thinking about the microbiome in this context can be really important. And how do we get the microbiome back to more looking like you were in your pre-menopausal years?
Yeah. Going on from that, you just brought up hot flashes, mood swings, memory changes, and metabolic shifts like weight gain and a higher heart health risk, which are all really concerning. And I think a lot of women with perimenopause and menopause go, oh, I'm just having another hot flash, or oh, I can't sleep tonight. I don't think we should normalize this dysfunction. These are really serious symptoms that need to be taken very seriously. Just because throughout history we haven't taken them seriously doesn't mean we shouldn't now. How much does dysbiosis explain or worsen these symptoms, especially as estrogen's influence on the microbiota fades? And I would also say we're seeing more influence from insulin resistance and possibly high IGF-1, and we know that that can increase inflammation in the gut specifically. Do you mind answering that question just on how these are connected to the gut specifically?
Yeah. So the estrogen drop changes the microbiome composition. And so a disrupted gut doesn't necessarily cause the symptoms. It acts more like an amplifier. So when those imbalanced microbiome changes, in the hot flashes, the mood, the weight, inflammation, it can affect the gut-brain signaling. And so I think that there's a few things to pick apart here. So first on mood and brain fog, with the lower diversity, that can influence serotonin, GABA production, and inflammation, and that disrupts the gut, the neurotransmitter signaling access. So dysbiosis then is generally linked to higher anxiety and depression. And then on weight gain and heart risk, postmenopausal women with that more male-like gut, that's what can contribute to the insulin resistance. And the oestrobolome can become especially more important after the ovaries stop making estrogen. your gut's handling of estrogen matters more than ever. So we want the dysbiosis, so that we want the bacteria to handle estrogen appropriately so that that estrogen gets recycled. And then, so it's back to supporting gut health through fiber, diet, and management of sleep and stress, especially with women that don't want to go on hormone replacement, because sometimes that is a really good fix. It can help restore the gut microbiome to the gut that look like a premenopausal woman.
That was my next question was, okay, what about if people go on hormone replacement therapy and what does that do to the gut microbiome? So you're saying that perimenopause and menopause, we're seeing the gut having all these changes that are a little bit more inflammatory and not associated with good health outcomes, and also associated and looks closer to a male gut microbiome, which is fascinating. And then when we take that woman or that person and we put them on hormonal replacement therapy, which might be a combination of testosterone, progesterone, but most importantly estradiol, you're saying that we're seeing the microbiome shift back to a premenopausal state.
That's correct. Yeah. So there's a lot of benefits for hormone replacement. Not only does it help with the symptoms of menopause, but also bone loss, cardiovascular risks. So it's the most direct way to address the microbiome changes. There also is some really good evidence of dietary changes. One specific study I was reading was looking at low-fat, plant-based diets, higher in soy-based foods, and that helps shape the microbiome as well. And that study highlighted the 80 to 95 reduction in moderate to severe hot flashes. So maybe the driver of that is those estrogen-like phytoestrogens found in soy foods that can help feed the gut microbiome that were once there, get them back on board. So between diet and considering hormone therapy, those are two good approaches.
Which is wonderful. And I think there's still a lot of fear in at least the holistic women's health world around HRT. And I'm such a huge, strong proponent for hormone replacement therapy. I saw my mum go through menopause really early and it saved her life. It saved so many different elements. But I never once thought about how phytoestrogens in soy could have a positive outcome on postmenopausal women's health via the gut. Because that's the whole thing that's going on online at the moment. Are phytoestrogens safe? Is soy safe? Is flax safe? And we're seeing this huge benefit for populations of perimenopausal women and menopausal women. There's a reason why Japanese women don't actually have a word for menopause, because they're always eating those phytoestrogens and their gut is being exposed to it. That is so fascinating. How would you assess and manage a postmenopausal woman who develops new GI symptoms, mood changes, or metabolic issues with a focus on her microbiome? So the same thing again, what are the things that you say a lot in your clinic and you feel like you could put on a record and just pop it on repeat in your clinic waiting room?
That's a good question. So I think the first is a detailed history, period, and also food history. And what I found is that with women that go into perimenopause and menopause with a healthy, balanced protein and plant-rich diet, they tend to have an easier transition. And I mentioned that women that have never had to think about nutrition suddenly having to in menopause, I know that it's time for a nutrition makeover. So that's always a pillar of our discussion points when working with the postmenopausal gut. So food first, that's always my approach. And that diversity, reinforcing diversity and variety. So it's not just what's on your plate, but the variety that goes there as well. So specific foods, we think about foods that tend to be more anti-inflammatory, those high in omega-3s, things like polyphenols, like berries and olive oils, green tea, I recommend a lot, regular or decaf, there's those antioxidants, and ground flaxseed. I do tend to recommend that a lot as well.
Okay, amazing. Let's move on to clinical integration and forward looking into the science, which is super nerdy. From your clinical experience, which of the following fetal microbial composition tests or short chain fatty acid levels, so zonulin, for example, might be good? Like, what are the ones that you say in your clinic when you say, for example, someone is presenting with primary or secondary dysbiosis? What do you go, okay, I'm going to order this test and I know I'm going to get a good reading for it, for example? Like, what are the ones that you go to and you trust a lot and think are quite important clinically?
Yeah. So I think fecal microbiome tests are really helpful in showing us bad bacteria, what's beneficial, yeast, parasites. They all tend to be just a tiny snapshot in time, though, so they don't always paint the whole picture, but I do feel like they give a good roadmap of where to start in rebalancing the microbiome. I would also say that tests that measure inflammation, markers like calprotectin or lactoferrin, those can be really helpful. And then pancreatic function. So the pancreas makes enzymes that help break down and assimilate our food. So stool markers like elastase are also very helpful. Some tests add in the short chain fatty acid measurement as well. And basically what short chain fatty acid tells us is the functional output of your microbiome. So you're inputting all these fibers and maybe even probiotics, but what is your body doing with that? Is your body actually then making on its own more of those probiotics? So with a short chain fatty acid assessment, we can reliably tell patients, here it is on paper. You need more fiber. You need more diversity. So that can be a really helpful marker as well. Zonulin, that's a good marker of increased intestinal permeability or leaky gut. There's another test called the lactulose mannitol test that seems to be a little bit more clinically validated, but I found that using either of those can be really helpful. And I think it's very practitioner dependent as well. So we often get into our little boxes as I like this test. And when you consistently, see patterns in a certain way in practice, then you just get comfortable with addressing the things that are found in your specific method of treatment.
Yeah, and your practitioner needs to know how to read those as well. And I guess everything is different in different countries and even states as well. What does the latest evidence say about using prebiotics and probiotics and postbiotics? First of all, can you please explain what those are? What is a prebiotic? What is a postbiotic? And what is a prebiotic? Because I think people use these interchangeably and think they're kind of all similar, but they're not. They're quite distinct and they have different impacts on the gut microbiome.
They are very distinct. And so on prebiotics, think of prebiotics as like food for your gut microbes. And from my perspective, I don't really see a need for prebiotic supplementation because that's where food comes in. There's some cases where I've seen prebiotics from a supplements make certain conditions worse. Small intestinal bacterial overgrowth is a good example of that. So I usually don't suggest spending a lot of supplement dollars on prebiotics. And then on probiotics. So these are the bacteria that we specifically supplement with. And many probiotic supplements are on the market these days. Some of them are lactobacteria, bifidobacteria, Akkermansia, bacillus. There's a whole spectrum of probiotics available. I found that there's no one size fits all. Some patients will tell me this didn't work, or I reacted negatively to this. It gave me more diarrhea or more bloating. So it can take a while to find a combination that seems to suit the person well. The other thing that I would say about that is when we're adding microbes into the system, we shouldn't always take the same things. So if you've landed on a probiotic that works for you, think about changing that up and trying something new every so often. Maybe that's 6 months or a year. And then postbiotics. So that's basically leftovers from your good bacteria. So this is where short chain fatty acids come in. So after your bacteria make the short chain fatty acids, they make vitamins, they keep your gut lining healthy and strong. So that's not something necessarily that we take, but rather that we make internally.
So prebiotics are what feed the people, the people's outcome, and kind of, I guess, fart. And I guess it is post-consumer waste, really, for our probiotics. Short-chain fatty acids is waste products that our body finds really, really useful, and we use things like butyrate throughout the entire body, for example. Okay, so going back to that, what does the latest evidence say about using these? So prebiotics, probiotics, and postbiotics in women's health. Are there any particular strains or formulas that you've found especially effective? I mean, for me, I can speak to this. I went to Southeast Asia 2 years ago and I got really sick and I had to take a bunch of antibiotics, came home, did a stool analysis, and I had no lactobacillus. I had
Mhm.
no bifidobacterium. And so that told me, okay, I need to go and take a supplement with
Mhm.
bifidobacterium and lactobacillus. Would you say that that's kind of how you use gut stool tests to look in the microbiome and go, okay, you're down in butyrate. We need to feed this specific probiotic and we need to use this specific food for that, or different type of soluble fibers. Do you mind mapping out what that might look like for you in clinic when you get someone's stool analysis back?
Sure. Yeah. So stool analysis is sometimes limited in the commercially available strains that are highlighted there. So you use two really common examples, the lactobacillus and the bifidobacteria. And so since those are so prevalent, those are pretty easily sourced commercially in probiotic strains and varying strengths. The other thing I say is it's good to look at patterns. So if it's like generally everything is low, or there's certain families that are off, we can think about, do we need the actual strains, or do we need what I like to call like the fertilizers for those strains? So that goes into the different types of probiotics. So the lactone bifido versus like spore-based probiotics, where spore-based probiotics aren't any of those things that we would see on a test, but the spores are probably like planting a seed and then allowing the good bacteria to grow. Whereas in the other approach, you're taking those specific strains like the lacto and bifidobacteria. So overall trends are important to look at sometimes, rather than just the few specific strains that might be off. Although I do see a lot of times a specific strain called Akkermansia is tending to be low in a lot of my patients' microbiome stool analyses. And there's some good research between metabolic health and Akkermansia. And luckily, that one is commercially available. So I'm curious at the mechanism by which we could actually support that through foods and dietary changes. I'm not clear on that, but I do tend to recommend Akkermansia as a single strain quite often.
There's amazing research linking Akkermansia supplementation and improvements in metabolic
Yeah.
syndrome outcomes and health for women with PCOS or PMOS,
Right.
especially as well. I talk about that in my book.
Yeah.
That like supplementing with that, if you can take one probiotic for about 3 months, you will see huge improvements specifically in
Mhm.
insulin resistance. It's a pretty amazing little microbe.
Yeah.
What are the biggest myths that you see about the gut hormone connection? And what do you wish every woman understood about this vital relationship between her hormonal body and her gut body?
So I think that one of the biggest myths is that you have to have gut symptoms to investigate further. And so I think that this whole discussion points us in the direction is that the gut is the backdrop for a lot of things hormonally, but also systemically. So I think that, just asking about gut health in a very detailed manner, and if there's nothing there, still taking into consideration the gut health is really part of that healthy foundation, and it's required to heal. That was part of my philosophical training in naturopathic medical school, was that health starts with the gut. So we're always taking that into account. I would say another myth is that you have to take probiotics. We talked about ways that you can help support a diverse microbiome just through food variety, and also that the gut is sometimes an afterthought. That's another big myth, is sometimes I'll go through an intake with a patient and they'll tell me all about their problems, and we get to asking about gut health and they'll tell me they're only having a bowel movement every 3 or 4 days. I'm like, wait, now this is problem number one. We're going to start there.
Yes.
And then we'll go back through the rest of your list. So I think that every woman should really understand that this is a vital part of not only hormonal function, but everyday function in your sleep, your energy, your inflammation. It starts with the gut.
Always starts with the gut.
It starts with the gut.
Absolutely. And ending on an exciting note, like
Yeah.
what are some things in the research or things that have just come out, or you've just seen an RCT that's just been published? What is something that you're really excited about in the gut health space? What's something that you think will actually be really applicable, or you just think is fascinating for women's health in the gut?
So I think that my answer to this question is a little bit more broad, but it kind of goes back to what I was saying, that we always take the gut into account. And I think that the more studies that are being done on specific dysbiosis scenarios and other conditions. So what I mean by that is, a pathogen that's maybe connected to an autoimmune disease, or perhaps a skin disorder showing these disturbances in the gut. So that gut is always going to be that backdrop for solving bigger picture problems. So I think the research that points to the gut as being a more necessary part of treatment across a huge range of conditions, not just the ones that are showing up as a gut associated problem. So I spoke to that a little bit when we were talking about that specific strain of bacteria for PMDD. To me, that's so fascinating because that highlights how there might be one gut intervention that really leads to a big change in someone's experience of mood disorders. So as that research continues to evolve with any type of systemic condition, I think that will be very fascinating.
Well, thank you so much. And where can people find you online?
Yeah, so my website is the best source of information about me, kellysimsnd.com. And there I have information about my background and my practice. And I also do some regular blogging there.
All right. Well, thank you so much for joining us today. I really appreciate your time.
Yes, thank you.
Hello, everyone. Hopefully you enjoyed that interview with the amazing Dr. Kelly. I just wanted to close up with a few specifics because I know that a lot of people come here for specifics, and that interview was really amazing so you can get the baseline understanding of your microbiome. But I'd like to leave you with some tests that you can do, with markers to look for, what they represent, and how to kind of read a gut microbiome analysis or find someone who can, just to give you a bit of understanding, and some tests at the end of it in 3 different regions. So US and Canada, in the North Americas, Australia and New Zealand, and I'm also going to give you a test for EU and the UK. If you have any suggestions for gut microbiome maps in your country or region that you'd like to recommend, please contact us on Instagram, or you can contact us through the contact form of our website so you can recommend it to other women. So let's get into what a good microbiome test actually tests and what you should be looking for. So just to give you a bit of a segment map so we can understand what we're going to be looking at here, we're going to be talking about like why this section is really important, what makes a test worth trusting, and what it makes a good test and a bad test, what primary dysbiosis markers are, secondary dysbiosis markers are, and reading this as like a story. So looking at your gut microbiome test to look at the history of what your gut microbiome has been through, what it represents now. So let's get into the first section of like what actually makes a good microbiome test. So firstly is the sequencing method, and there's a few different methods that are being used. The first one is the 16S sequencing RNA. This is older, it's also more affordable, and it only reads one gene segment of each of these different bacterioids. It only resolves bacteria to a genus level, not the exact species. So just like us, we have Homo sapiens, Homo neanderthalis, we have a genus, Homo, and then we have the species, sapiens, for example, and we have that in bacteria and virus, fungi. So Candida, and then is it albicans? So 16S RNA sequencing only looks at one part of that gene sequence, and it doesn't actually tell you what specific species are there. So it's not a very specific test. It can be really good for getting an overall look at what your gut is looking like and what genus is there, and you can make some conclusions from that, but it's not so specific, which can be good if you're generally of good health and you're just noticing some weird changes in your gut microbiome. That's great. So your 16S RNA sequencing can be good. But if you have IBS, if you have SIBO, you are going to want more specific. You don't want a rough diversity snapshot. You need something really specific. And that's what shotgun metagenomic sequencing is. That reads the entire genetic material in the sample. It resolves organisms to species and often at strain levels as well. So it's ultra specific, and it can also pick up fungi and other viruses that 16S misses entirely. That's the depth you want if you have gut microbiome issues. So if you're just looking for a general checkup, like I did recently, that 16S sequencing is really great. But if you want something more specific, that metagenomic sequencing is going to be what you want. And lo and behold, it's more expensive. By far, it's more expensive. But if you have ongoing issues, it's worth the investment. There's also DNA and RNA. So DNA is what's inside of our cells. RNA is kind of like another strand of DNA. It's one half of the DNA. It doesn't have a dual helix. It has one helix. And they're a little bit different. So DNA-based testing in your microbiome mapping tells you if a microbe is present. It does not tell you whether that microbe is active. So when we have RNA, that's we're basically splitting that DNA in half. We're taking a copy of that DNA, and that's RNA. So when RNA is around and we do RNA-based testing in your microbiome, this measures gene expression, which is really important in the gut. It actually gives you a snapshot of what the microbiome is actually doing at the time of the sample. So the DNA is telling you what's there, what microbes are there. Awesome, we know, but we don't know what they're doing. And that's what RNA sequencing is really, really great for, because it's telling you, okay, you might have bifidobacterium, but we're not seeing any RNA for it. So the bifidobacterium is just sitting there, not really doing much. So it's there, but it doesn't have any RNA, for example. And so that's that primary and secondary dysbiosis, right? So that primary dysbiosis, that's telling you, okay, bifidobacterium is here, but if there's no RNA, it's telling us it's not transcripting. It's telling us it's not doing anything in the gut. So that's that secondary. So that's what that is for, right? So DNA is kind of a primary dysbiosis marker, and RNA is telling us a secondary dysbiosis marker. So you can have completely fine primary symbiosis. So you have all of the right bacteria there. We don't have any opportunistic bacteria, or they're under control. That's awesome. But if we don't have any RNA of our beneficial microbes, then that's secondary dysbiosis, for an example. Another thing is it needs to be processed in an accredited lab, and most pathology labs are accredited now, especially if they're looking at stool-based analyses, at least in Australia and New Zealand. You don't want an unregulated lab, because that's going to really negatively impact the reproducibility of those results. Okay, so let's get into primary dysbiosis markers. So remember what Kelly was saying, who is there? Right? So we want diversity and richness in the microbiome. The single most load-bearing result on your microbiome stool test is going to be the diversity. So how many different microbes do we have in your gut? And are they beneficial? Are they making short-chain fatty acids? A diverse ecosystem has redundancy built in. If one species drops out, another can cover its function. So that's why we want diversity. Low diversity in of itself is a marker. Independent of any single organism being high or low, it signals the gut ecosystem is more easily tipped by antibiotics, illness, or a rough month of eating. So what are we looking for here? So we want beneficial commensals. So these are the organisms you want to see present and abundant. So remember Akkermansia we were speaking about before. This is the mucus layer specialist, and this is really great for prevention of intestinal hyperpermeability, aka leaky gut. It's often called the centennial of the gut. It supports gut barrier integrity, helps to modulate the immune response, and enriches other butyrate producing bacteria. So it doesn't really produce a lot of butyrate itself, but it supports its other friends that do. Also, Faecalibacterium, one of the largest single contributors to butyrate production in a healthy gut. It's sometimes accounting for over 5% of total bacteria in stool, which is massive. And butyrate is the primary fuel source of colon lining cells. So remember, our epithelial cells in our colon, they use butyrate as an energy source. So if we don't have short-chain fatty acids like butyrate being made, our epithelial cells don't have energy and they can't hold those tight junctions together properly. When we have low levels of either of these, that signals to investigate. It's not a diagnosis on its own. Also, bifidobacterium, Akkermansia, and lactobacillus species are all really beneficial, and we should be seeing pretty high levels of these. Let's go on to opportunistic organisms. They're not necessarily bad bacteria, they're just overrepresented, and they can start to cause problems or be associated with problems in the gut microbiome if you see low beneficial microbes and then higher opportunistic. These are organisms that exist in small numbers in most healthy guts and only become a problem when they expand beyond their normal share of the ecosystem, usually because something else has been displaced. And really important to come back to that word opportunistic. That word is doing a lot of work here to explain the situation here. It means the organism took an opportunity created by a disrupted environment. So they don't cause the problem, they're just associated with the problem. They're the canary in the coal mine. So what are some types of opportunistic bacteria you might see? So the whole genus, I would say, of Enterococcus is a pretty opportunistic bacteria. Mucoid E. coli, Proteus mirabilis, and the entire genus of strep, basically, that you see in the gut. You can also see some staph here as well. So these are, I know when you probably hear staph and strep in the gut, you're thinking, God, that's a really big problem. Yeah, it can be. They can be pretty problematic, but they are generally under the opportunistic label. Next, we have your gram-negative load. So these are bacteria that are broadly classified by their cell wall structure, a gram-positive or a gram-negative. And this is one of the most genuinely useful ways to read your report. Gram-negative bacteria carry LPS. Remember how we were speaking about LPS before in your gut that can get past your epithelial layer and can cause problems, that can trigger a lot of TNF alpha, interleukin 8, interleukin 18, and then CRP and HS-CRP down the road. That's a lot of inflammation. So it's associated and it triggers a lot of inflammation in the body. So gram-negative bacteria, they have LPS on the outside of their membrane. And LPS is an endotoxin. It's not dangerous while it stays inside the gut lumen, but it becomes a really big problem once it crosses the epithelial layer, and then it can trigger off a huge cascade of inflammatory events inside of the body. An overrepresentation of gram-negative organisms raises the total LPS burden, and the gut barrier has to contain it, and it's really hard to contain those. And LPS and gram-negative bacteria is kind of the bridge into secondary dysbiosis. Gram-negative isn't the scary label on its own. It is a part of the cell wall structure. And the question with LPS and gram-negative bacteria is how well your gut is holding up. So is there a lot of LPS in your stool? Cool. But is it passing through the gut barrier? And one of the best ways we can look into that is something like zonulin. So let's get into the second part, which is secondary dysbiosis markers and what it's really doing and what it's really showing you. Number one is zonulin. This is quite popular and for good reason. It's the barrier marker. So zonulin is a human protein. It's not a microbe, and it regulates the tight junctions between the gut lining cells. Think of this protein as the gatekeeper for how permeable that lining at any given moment is. So if your stool microbiome test comes back with high zonulin, that points to a compromised gut barrier. So the zonulin isn't staying in the tight junction of the cell in your colon, it's falling out and it's coming out in your stool. So high amounts of that means high amounts of leaky gut. Alongside zonulin is also calprotectin. So this is the inflammation marker that you should be looking out for in your gut microbiome test. It's a well-established indicator of gut inflammation, and it's really relevant if you have inflammatory bowel disease. It helps distinguish genuine inflammatory activity from functional gut symptoms. It's an important line to draw before assuming every symptom is just IBS. And we didn't talk about IBS in this podcast, and I have a bit of a gripe with it. And I think a lot of people in health do as well, because IBS is just kind of this umbrella term. It doesn't actually tell you what's going on. It's just a term that basically the medical industry has created to go, your gut has problems. We don't know what they are. So we're just going to give you this label of IBS. Maybe try a stool test and maybe do this and maybe do that. Maybe try and have some metamucil. You know, it's I'm going to do a whole podcast one day on IBS with someone. Hang tight on that. But the next one we want to be talking about is secretory IgA, also known as SIgA. It's a pancreatic elastase. SIgA reflects frontline gut immune function, your mucosal defense system doing its job. Pancreatic elastase reflects digestive sufficiency, so whether you're actually breaking food down before it reaches the colon. Together, calprotectin and also SIgA, they can be really, really helpful in answering the question people rarely think to ask. Is this bloating a microbial problem, or is it simply undigested food problem? So that's the thing that your stool should be picking up as well, is undigested food. So it will be looking at the amount of fat, protein, and carbohydrates and fiber in your stool as well. And for example, if you have low bile flow, you won't be able to digest fat-soluble vitamins like A, D, E, and K. So that'll come out in your stool, and your test will come back and say you're not digesting fat properly. So you need to work on your bile, and you're not digesting fiber properly. So maybe you don't have a lot of beneficial microbes that can break down that insoluble fiber. And SIgA gives you a bit of a snapshot on how you're digesting food and whether it's a microbe problem, whether it's a digestion problem, whether it's something happening upstream or downstream. Next is beta-glucuronidase. Not a lot of stool tests actually look at this. And if you have estrogen dominant symptoms, I think it's really important to look at this enzyme. It's a hormone crossover maker. So this enzyme is produced by certain gut bacteria. It's involved with deconjugating metabolites, including hormones like estrogen. So basically, the liver does this amazing thing. Let's use estrogen as an example. It conjugates estrogen. It kind of adds something to it, so it can't be used and it can't attach itself to receptor sites. Once it gets into the gut, beta-glucuronidase that's been made by different microbes in the gut can take this conjugation off, deconjugate it, and push it back into circulation so it can be reabsorbed. And so that's why if someone isn't having a poo every single day and she has high estrogen, we know that beta-glucuronidase might be working overtime, and we need to look at her gut and figure out what's going on. That's why calcium D-glutarate works, because it turns off beta-glucuronidase and it actually allows the conjugated estrogen to leave the body. But that's with other hormones as well, like testosterone and progesterone, for example. Another secondary dysbiosis marker that we can look at is short-chain fatty acids. Remember, the byproducts of all of our beneficial microbes, butyrate, propionate, and acetate, for example, they're really, really useful in the body. And we can test how many are in our stool and the diversity of them. And then we can match that to different microbes in the gut as well. And so we can have a look at primary and secondary dysbiosis. First up is butyrate. Remember, that's the primary fuel source of the cells of the lining in your colon. It promotes gut integrity, and it reduces inflammation directly. Low overall short-chain fatty acids are a functional red flag pointing to reduced microbial diversity and them not functioning properly, because they can be there, but maybe they're not functioning properly. Maybe you have a low fiber diet and they can't do the work they need because they don't have the energy they need to do their job. Okay, so let's get to the test. Let's start with Australia and New Zealand. I really like iScreen. I'm just on their website now having a look through. I did their microbiome check, which is 32 tests included. It's pretty great, I would say. I was really impressed with it. I was in Southeast Asia and I did this test when I got back because I got really sick over there and I needed to take an antibiotic. And I came back and I had very little bifidobacterium and lactobacillus, and I started to have some weird symptoms. And then I was like, okay, cool. So this is primary dysbiosis. So the people aren't there making the short chain fatty acids and doing all of these other things. So I'm going to go and find a probiotic that are rich in bifidobacterium and lactobacillus. I'm going to eat fermented foods that I know are really, really high in these microbes. I haven't retested, but I need to do it again. I really like iScreen. They send you the test kit. Let me tell you, it's real bloody humbling being in your bathroom and putting your stool in 3 different solutes, mixing it together. And then it's super weird putting in the post box. It's really weird. But I got my results back in about 10 days, which I was really impressed by. And it's really easy to read through as well. They look at parasites, potential autoimmune triggers, yeast. They also look at all your opportunistic, pathogenic, and beneficial bacteria. They also look at your digestive and metabolic markers as well, your microbiome snapshot, and they also look at fecal macroscopy, which is your stool color, stool form, mucus, and fecal occult blood, which is really, really helpful as well. So that's iScreen. Next for my North American girlies, so Canada in the US, is Viome. They have a few different gut tests that you can do. They have the gut intelligence test, the full body intelligence test, and the oral health intelligence test. You can just go for the gut intelligence test, and they have a 4th of July sale on today, so you can save about 70 US, which is about 100 Canadian dollars if you order it kind of soon. And they look at a bunch of different things. They look at gut health insights, they look at your food recommendations as well. And something on food recommendations, I don't back this. This test is pretty good for the test they look at for your gut, but I do not ever recommend paying any attention to your food recommendations. They are based on IgG food insensitivity tests that are not backed. They're not evidence-based. It's just something that I think a lot of these companies add on because I think that they think it adds value, and IgG food insensitivity tests are pretty cheap to do. The traffic light system for foods and stuff like that, it doesn't work that way. It just tells you the food you're eating a lot of. It's not actually telling you how you're reacting to that food. There are tests for that you can do with a dietitian or a doctor, and they're called allergy tests. And so if you think that you're reacting to a food, go and do those allergy tests with a health provider. Food insensitivity tests done in this way, I don't back. So I am just going to say that. But the rest of this is pretty good, and they recommend what you're low in and what you can bring up and what foods are rich in that, for example. So Viome is pretty good for that. And finally, for the women listening in the EU and UK, Biome site is pretty good. They have a gut microbiome snapshot, and then you can also get 3 tests of the same test. So you can get 1 test or 3 tests, which I think is pretty great, and you get a big discount. So I think if you get 3 tests, it's usually about £1,000. But if you just get the 3 in one go, it's about 700. So you can save about, I don't know, £300 to £400, but it's pretty good. It gives you a good insight into what bacteria, probiotic, and what commensal bacteria you have. It also looks at all your short chain fatty acids, looks at toxin and neurotransmitter producers. It also looks at how you're synthesizing vitamins and things like that as well. So it's a pretty good test. If you want all of the links for all of these, I'm going to hyperlink them all below. If you're watching on YouTube, then it's going to be just links pasted. Sorry, I know it doesn't look very attractive, but all of them are there for you. If you wanted to do a gut microbiome test, I did one this year and I really loved it. I think it's something that we should just be doing every single year, especially if you have any gut microbiome issues, especially if you're dealing with any symptoms. Always look into the gut. It's really important to consider the gut as a part of your overall health and well-being. Thank you so much for taking the time out of your busy day to listen to this episode. If you loved it, please remember to like, subscribe, and send to a loved one. If you want to learn more from Akkerman, please check out the website at akkerman.com.au, where you can find a plethora of offerings like charts, masterclasses, courses, and organic clothing. You can also head over to patreon.com/Akkerman or substack.com/Akkerwoman to join the community. I hope you have a really beautiful morning, afternoon, or evening wherever you are in the world, and I will see you on the next episode.